All right, so we are live. First of all, let me make sure we are connected. All right, boom. So we are live. We're ready to go. Good evening, y'all. First of all, sorry I'm running a little bit late. We had game night in the house tonight with the family. It was a fierce competition in Connect Four, and what do we played? Connect Four, Twister. Yeah, and some operation game. So fierce competition there. So I apologize for running a little bit late, but we are here. I am getting yours truly, Dr. Pierre, favorite board certified internist, founder of drbarrypierre.com, bringing you another edition of what we call Friday Night Live Stream with yours truly, where I just talk about, some current, events that, pick up throughout the week for especially from obviously from a medical related tip. And again, I broadcast live not only on all the platforms that are watching this now, whether you're on my Facebook page, whether you're on Periscope / Twitter, whether you're on YouTube as well. But I also talk to my Instagram folks. So occasionally you will see me kind of look in this direction as well. And that's how you know that I'm talking to my Instagram folks. But and I want to make sure I don't miss any comments. Because I think last time it was so hype. We missed some comments last time. So I'm definitely making sure that no comments get missed. The topics at hand, like I said, is going to be, of course, COVID definitely dominates, everything right now, especially in the medical world. You can't read a journal article, right, that does not have COVID tied into it one way or the other. We're seeing a lot of positive related things associated with COVID. We're seeing, cases decreasing, right, as far as the sheer number of cases. We're seeing the number of people dying decreasing as well. Most importantly, like we're seeing these vaccines and really the work, right, that our our administration has been putting on to get the vaccines to the people, right, has been doing a phenomenal job at that, right? So definitely want to, definitely take some time out and, give a shout out to the new administration for the work that they're doing, right? It's a clear contrast, right? Clear contrast from where we were a year ago when, the last administration was downplaying like how severe this is, right? Again, the numbers, right? About over 530,000 people have died from COVID-19. And what we're hoping, right, is that 2021, right, has some brighter outlook to it, right? And I'm pretty optimistic, right? Like I'm pretty optimistic with the things that we're doing that's gonna happen, right? So definitely shout out to that. Shout out to admin as well too. So we're gonna be talking about a few things today. As right, we now have not one, not two, but three players in the vaccine battle, right? Especially here in the United States, right? I'm focused on the United States. Here in the United States, three players: Moderna, Pfizer, Johnson & Johnson, emergency authorization use, full in effect. People are getting vaccines full in effect. We talked last week, Johnson & Johnson, their goal is to push about 20 to 30 million, by the end of this month, right? And then by 100 million by the end of the year, right? So very ambitious goals, right? We love ambitious goals, right? Especially when it comes to be talking about like trying to fight, this virus that, has been kicking our butt, for quite some time, right? So definitely happy about that, right? So I was talking to a couple of friends of mine who's already gotten, the Johnson & Johnson vaccine. It's such a benefit. Like I said, we've again, we won't talk on nauseam here, right? But such a benefit of having, this third player around that's really going to kind of help get the numbers up, right? And by say get the numbers up, right, it's really going to help increase the people who are going to get this vaccine, right? Because again, the Moderna was here, the Pfizer was here, they came around Christmas. But there's issues, there's concerns, right? And people had some questions and they wanted to hold off, right? So now we got this third player coming about, and now the holding off isn't happening as much, right? So definitely happy about that in that regards, right? So this week some news came out, right? And what's funny now, especially when we talk about the COVID virus and COVID vaccines, is a lot of the news when I start getting news pop-ups on my phone, alerts popping up on my phone, it's not even like medical organizations anymore, dropping, the latest news on this COVID vaccine, right? It's a lot of business, finance related like websites that are saying like, hey, guess what happened? Guess what is out? And they're like putting out the numbers because again, when you're in a global pandemic and you got a virus that's affected our economy the way it has, the business folks, the finance folks, they're interested as well in making sure that they get to where they need to get to. So here, like I said, if you're following me on Instagram, like I am live on, all of my other places, Facebook group, Periscope, Twitter, YouTube. So I'll be kind of sharing my screen there so you can kind of catch and peep that. Let's talk about the Novavax variant. That some numbers came out, which we are very, very excited for, right? And reason being is because again, it is. I want to make sure I pull up the. Yeah, perfect. All right, and the reason being, and I'll maybe larger screen, is that it is another player, right, in this battle against COVID-19, right? That's such a huge aspect there. But the numbers were very encouraging, right? So again, it looked at a lot of the cases in the UK. We know, especially now, unless you've been sleeping under a rock, a lot of the fanfare discussion that's starting to happen now is, well, these variants are popping up, right? Again, we talked about this, right? Variants pop up, right? Variants happen, right? We know that. It's one of the reasons why you got to get a flu shot every single year, because variants happen, right? So it's not new. It's not surprising, especially to any of the Lunch and Learn listeners. But again, if you're new and you're just really getting acclimated to health and just you're seeing all these, a lot of publicity around things that you're not used to seeing publicity around, it may worry or scare you, right? So the Novavax vaccine came out. And their numbers, look very, very good, right? This vaccine, this study trial actually looked at the incidence of cases not only in the UK area where the variant numbers were high, but also looked at the area in Africa as well too. Also, the variant of that was high as well too. And I just want to kind of scroll to get my numbers down here. Let's see. Oh, give me a second. Let me share this other screen. This one had better numbers for us. I know we like numbers here. I keep sharing the wrong screen. Oh, there you go. Perfect. All right. So this one here, right? So again, Novavax vaccine, 96% effective against the original coronavirus version in the UK trial, right? Absolutely phenomenal, absolutely amazing, right? Saying that again, based on looking at the old vaccine that's out there, we're really, really good, right? And even if you took in account of the variants that are there, 86% effective against the UK variant, 55% effective in the South Africa variant, right? We know that's a little bit more, susceptible, more contagious in that regards, right? So showing the level of efficacy is so important, right? But like what we talked about last week, right, is that it's not such that we care about whether you get the virus, right? Again, we care. Of course, we obviously care if you get the virus. But most importantly, are you going to get sick and have to see someone like me if you get the virus, right? That is the question at hand, right? And both, I love this, right? In both trials, the vaccine was 100% effective in preventing serious illness and death, right? Like that's all you really need to know, right? Like you may not need to know, the mechanism of, some of you may want to, right? You may not need to know the mechanism of action, right? You may not need to know, how effective, but if you know that the likelihood that when you get this vaccine, are you still going to get so sick that you'll end up having to see me, Dr. Pierre, in the hospital, right? Like that, guys, is what's really, really important, right? Again, and I'll put the the link to this article in the comment section so y'all can check that out yourselves. It's a big deal, right? This is a very big deal because you have another player, right? And again, now we're still early, right? Like I haven't talked about it getting, going by the FDA and, getting like it's not there yet, right? So we still are with just 3 players right now, but understanding that we have more players on the horizon. Like we talked about this before. Even when the vaccines came out, we say, hey, right now, yes, we got some limited choices. We only got 1. We only got 2 choices, but there's plenty in the pipeline that are coming, right? And we're starting to, and I want you guys just to be as focused on the players that are in the game, but think about the players that are on the bench ready to come off, right? Like that's the analogy I want you to think about. There's a lot of players that are in the bench ready to come off, right, to help us, right? Again, 29 million people have this virus, right? A lot of people have this virus. Right, 530,000 people died from this virus. Right, we are going to need all hands on deck, especially if you're one of the ones who can't wait, to get back to quote unquote normal. Right, if you're one of those people who can't wait to spend time with your family again, right? Without this fear, without this concern, right? That you're going to be responsible for getting grandma sick, right? Like if that's the thought process, which when I talk to people, that's a big thing for a lot of people, right? A lot of people want to get back to some semblance of normal, right? Whatever that normal is for you, right? A lot of people want to do that. And if you want to do that, right, you're going to have to, again, obviously continue the safe practices, social distance when you can, wash your hands when you can, wear your mask when you can. But most importantly, when it's time to get your vaccine, you got to get your vaccine, right? Like it just is what it is, right? When it's your time to get that vaccine, you got to go get that vaccine, right? So, and the question I'm getting now, especially, it's funny because when we had 2 options, which were kind of the same, I got this question, and now we got a 3rd option, and now people are like, hey, which one should I get? Right? Let me tell you something. You get, and Dr. Fauci already said this himself pretty much in the short tense, right? You get the vaccine that you can get, right? You don't need to be, we talked about Detroit we talked about that Detroit mayor last week where he's like, no, I don't want the Johnson & Johnson. Just give me the Moderna or Pfizer, which again is stupid, right? We talked about that, but don't go trying to be picky and choosy and being like all of a sudden now being concerned about like the numbers, right? We don't want you to do that. All we want you to do is get vaccinated and protect yourself, protect your loved ones, right? And this is what kind of leads me to the next topic at hand, right? So, we got these topics broken down, right? So we talked about the Novavax, right? Again, there's a lot of information on Novavax. I may touch on it more in our academic hospital, especially for my Instagram folks. I may touch on it more on the academic hospital series because we can kind of get a little bit better breakdown of what the Novavax is, what type of vaccine, because there's some key differences. But again, for this Friday night live stream, this ain't for that, right? This is just more of a quick boom. Hey, this is what happened in news. Keep it moving. I listened to one of my favorite podcasts, right? One of my favorite podcasts, that's the third podcast, right? And the comment came up, right, that folks are still kind of waiting, right, to get the vaccine, right? They say, oh, I'm gonna wait till a certain number of people get the vaccine, right? Which is again is a common question I get a lot, right? Like where it's common response where like, oh, the reason I'm not getting the vaccine is because I'm waiting for some more people to get it first, right? So. And again, it's one of those things where when you don't know, right, it's easy to say, right? Like when you're unaware of the information that's out there, right, that's a comment that's easy to say, and you might feel justified in saying it, right? So I want folks to know, right? Again, remember we talked about this before. If you have any questions, concerns, right, when it comes to COVID, right? Like even though again I'm up on here, I'm doing podcasts, I'm doing videos, I'm doing these live streams, right? Like don't listen to me, don't believe me, right? Like that's my disclaimer. Again, I ain't your doctor anyways, right? Unless I take care of you in the hospital, right? I'm not your doctor anyways. So you should be going to your doctor for health related advice. But in case you want this informational advice that I'm giving on a week-to-week basis, always fall back to your source, right? Always have a source that you can go to, a credible source that you can go to, right? To like follow up on what I'm saying, right? So the site I always recommend, I've been recommending this since last March, the CDC website. So like if you ask the general person, like, hey, you know how many vaccines we've given out, right? Do you know how many do you know what that number is, right? I think a lot of people would be shocked and surprised, right? Because again, I think there's a lot of people waiting for like this ball to drop with these vaccines, right? I think a lot of people are waiting for a surprise reaction that we didn't know about, right? You know, all of these fake Guillain-Barré, stories we're hearing out here. Right? I think a lot of people are waiting for that to drop to say like, oh, see, I told you about the vaccines, right? And so let's, again, if you're on my my streams over here, right? Let's share another page, right? Again, like I said, I love the CDC's website because again, I think it's so important and it's such a great backup, and it's a very easy read as well, which again is even better in that regards. Let's go to CDC. Perfect. All right. So you can't see, especially on Instagram, you can't see what I'm having now, right? But what we know, right? This is the COVID data tracker, right? So again, this is cdc.gov. I will put this link in the comments as well too, so you can follow along with me. Make sure. Yep, we're gonna put that so you can follow along with me. So as you can see, 29 million cases of COVID in the U.S., right? And I'll skip over the middle number, 529,000 deaths right here in the U.S., right? A lot of deaths, right? Unfortunately. But the most important thing, right? And this is what I really want to drive home, right? Is at this moment, we have had 101 million, right? Again, million with an M. We've had 101 million COVID-19 vaccines administered, right? Like given, right? Not like distribute, like boom in somebody's arm, right? So when you hear people say something like, "Oh, I'm waiting for a certain amount of people to get the vaccine first before I try it," ask them. 100 when ask them, hey, 100 million people have already gotten this vaccine. What are you actually waiting for? Because that's not the excuse anymore. Again, remember our goal, right, is not to not to argue, right, or say a person's point doesn't make sense, right? It's really just to more educate. That's what I'm here for. I'm here to educate you guys, right? So the goal is when you hear someone say, hey, I'm waiting for more people to get the vaccine, how many more are you actually waiting for? Right? Because as we speak, right, on this date, over 100 million people have gotten a vaccine, whether it's Moderna, whether it's Pfizer, right, whether it's Johnson & Johnson, over 100 million people have already gotten it, right? So are you waiting for 150 million? Are you waiting for two? Like, what's your number? Like, what's the number so we can stop asking you when you're getting your vaccine? So whenever that number gets hit, we can say, hey, it's 125 now. Let's go get your vaccine. Let's go protect not only yourself, but protect your family members, right? So again, like I said, I love this website. Like I said, COVID-19 vaccines in the United States. Again, at least per people getting one dose, over 65 million people, and there's over 35 million people who are fully vaccinated here in the U.S. Like I said, I am glad to say I am one of the 35 million people here in the country that are fully vaccinated. The CDC actually even breaks it up in terms of from an age-related standpoint. As far as those fully vaccinated, those not, you go to CDC, you can even check by your state as well too. Like I'm in the state of Florida, so Florida looks like about a little bit over 4 million have received at least one dose, and a little bit, which is about 19% of the vaccine that's been distributed, right? So definitely a lot of vaccines given out, administered, injected, right? So you guys don't have to wait for this magic number, right, to come out, right? Like 100 million people have gotten it, right? Like I promise you, if there was some secret like side effect that was going to come out, it would have already came out by now, right? Like if there was some secret side effect that we didn't know about, right, it would have already came out by now. It would have been all over the news. You guys would have been right. But like again, so those who are waiting for like this secret thing to occur, it ain't happening in that regards, right? So definitely, like I said, get vaccinated when you can. and don't worry about which one, just gets the one you're able to get. So I got a question on Instagram, right? So we're going to answer this question. What are your thoughts on intranasal vaccine? Read even going into phase 1 to say local mucosal immunity should be the best immunity. Interesting. Like I actually follow a few companies, right? So the question was my thoughts, and let me stop sharing my screen so y'all can see me. So the question was, what are my thoughts on an intranasal version of the vaccine? And there's one Altiumen. I'm sorry if I'm pronouncing that incorrectly. Going into phase 1, and it talks about just kind of the local immunity aspect, especially IgA being the best immunity, right? So first and foremost, right, like right now, of course, the vaccine administration that we've got now are intramuscular, right? So intramuscular, inject in the muscle. And it does its thing. So not only obviously these studies are early, right? But not only are there studies for this intranasal route of getting, right? Because we got the flu vaccine that you can get intranasally, right? So again, this kind of think about that same premise, right? The goal is getting it into the body system, right? But there's some companies that are working on an oral tablet as well. Right. So I'd have to read up on, because I don't know, I'm not familiar with the company. Right. And then I'll definitely read up on that and definitely bring that back for next week. But like it wouldn't surprise me if people were thinking about the intranasal route. Right. Because again, we've seen it do well for patients with the flu. Right. So we've seen flu vaccine been able to give intranasally. Right. So it wouldn't shock me whatsoever that an option, especially for this COVID-19 vaccine, be done intranasally. Because again, I've said it before. Again, I know I'm early, right? I've said this before. COVID-19 is not going to just like go away at the end of 2021. That ain't going to happen, right? What I expect to see, right? Maybe not next year, maybe in a couple of years, is that we'll get to a point where we have to take COVID-19 boosters. Right. What we have to, take a booster every couple of years, to get ourselves together. Right. Like, again, that's what I'm just kind of spitballing it. I'm just kind of looking, with like a, mini crystal ball. Right. But I do think, that opportunity is likely to occur. Right. That we'll have to, take some boosters on a day-to-day basis for it, right? So definitely something to think about. Very good question on intranasal, right? Like I said, I'm definitely going to read up on that, but like I'd be very interested in it, right? Because there's a lot of people, right, who from a side effect profile, right, they don't like, again, especially if you've gotten the vaccine, one of the biggest common side effects is the site discomfort, the site pain, right? The arm weakness. Your arm feels like it's like carrying like 20 bricks, right? So that is a very common issue and concern, right? For people who get it intramuscularly, right? Like to get it in the muscle, their muscle hurts, muscle pains, some muscle the early rhabdomyolysis, which is like kind of muscle breakdown. So that is a concern. So if you can like have a good efficacious drug, right, that you get. Take a deep breath in, right? And now you don't have to worry about doing it intramuscularly. That is an option to think about, right? So definitely something we need to keep an eye on, these intranasal routes for COVID vaccines. I definitely think that's going to be a player for sure. And then again, speaking about, like I said, I know we're talking a lot. We did a lot of this. This must have been vaccine week, right? But of course, right, when you have all of this news kind of roll up at once, right? This is kind of how it goes, right? So President Biden dropped a presidential address yesterday or so, and one of the things, of course, as a public health, folk like myself and physician, is that he said that by like May, right, I want all eligible adults, right, 18 or older. We know if you're Pfizer, you can get a 16, but we're not going to get that specific. I want all eligible adults to be able to get the vaccines starting May 1st. This is what I want, states. Like, and for those who may not realize it, depending on the state that you're in, right, you have different criteria that's occurring, right? You have different, like, no, in this state here, this certain population can get the vaccine, right? And especially and I'm thinking about the general population, the one who isn't sick, right? The one who doesn't have any like autoimmune related diseases or other diseases that may put them at a higher risk stratification. President Biden wants everyone to be able to get it come May 1st. right? And because, right, he's very ambitious, right? It's because, and let's talk about ambition, right? Like a lot of people kind of scoffed at his idea that he'd be able to give out 100 million vaccines, in 100 days, right? A lot of people scoffed at that idea. They're like, I don't know about all that. But again, I think especially when they think about the predecessor who was there before and they saw how dysfunctional that was, they had some reservations about that number. And one of the reports read that by day 60, right, he's gonna hit, and he's like day 50 now, I think. By day, so essentially in a couple weeks, he will have hit the 100 million mark for vaccinations, right? And we talked about this early, right? We talked about how there was going to be this kind of like snail-like, administration of the vaccines, and then it was just going to like almost like a hockey stick shoot up, right? Like we kind of talked about that. So, especially if you're a lunch listener, you're not necessarily surprised about the sheer number of vaccines we're putting out now. But like, again, a lot of people didn't give him credit for it, right? He said 100 million in 100 days, and people are like, I don't know about all that, fam, right? But here we are, right? Day 60, right? We're going to cross that 100 million mark, right? So definitely shout out to that. And now that, he's going to direct the states, right? Because again, remember, one of the biggest issues, right? And we'll talk depending on the state you're in. One of the biggest issues, early on with the old administration is that they gave the states no direction, right? So they didn't give the states any direction on how they should do these things, right? Like how they should administer, who they should administer, when they should. They didn't give them any direction. They were just like, hey, here's your allotment of vaccines. Do what you have to do, right? So you had certain states act one way, had certain states act a whole nother way, right? Like that's what occurred. That's what was happening. Now you have more direction from the top, right, down, right, and kind of saying like, no, this is how we're going to do it. This is how we're going to do it efficiently, right? And because you're having that aspect, right, is why you see kind of that hockey stick approach as far as people getting vaccines, right? And because that's occurring, right, because it's, like I said, it's a beautiful thing now. What we're seeing now is so many people getting vaccinated, right? And now May 1st, he's like, you know what? Every adult should have the opportunity to get it, right? So we're not going to have to worry about those risk stratifications, right? Like again, I was in the primary group, right? So as a physician taking care of patients with COVID, I was in the first group here in the state of Florida who could get it, right? So I got mine boom early. I got mine's Christmas. Around Christmas, a little bit after Christmas, I was there. So I got mine early, right? But if you weren't in that tier 1 group, you kind of had to wait, right? And what was interesting, like, of course, as a person who's vaccinated, that's great that you're vaccinated, but you're not necessarily you can't necessarily protect the people who you may be around, right? And you see the CDC actually kind of dropped those guidelines, which we kind of already figured that's what was going to be. That said that like, hey, if you're fully vaccinated, you can like go and mingle in small groups now, right? Like we're okay with that. But remember, right? And we talked about this, right? Even if like I'm fully vaccinated, and that's cool and all, right? But that doesn't mean anything, right? Because if I go, like, let's say I'm a carrier of COVID, even though because I'm vaccinated, I'm not getting sick from the COVID, I may be a carrier and then bring it to somebody else, right? Again, me and my mom were both vaccinated. My wife actually got vaccinated. She started her first dose of vaccination today. So she'll be fully vaccinated in 3 weeks. And then again, after 2 weeks after that, ready to go. So again, so now the CDC says, I can be able to hang around my wife. I can be able to hang around my mom pretty good, right? Like I'm comfortable doing that. And not have to worry, right, about wearing masks and everything else because we're all kind of protected. So May 1st is going down, right? And it's going to be funny, right? Because I think once May 1st goes down, it opens up, more people can get their vaccines, right? Of course, obviously, we're going to have to worry about access, right? Because access has been an issue that we're already seeing, right? So we're going to have to make sure our communities who want to get the vaccine have the opportunity to get the vaccine and not necessarily be bombarded or pushed away aside from different populations getting it before them, right? So we got to make sure our high-risk folks get it. But now that we're having the general public be able to get it, like, again, I think it's going to be some amazing things, right? I think you're going to have a drove of people who can't wait to get it, right? Especially obviously in the African American community, right? They talk about us having this level of I've seen the term vaccine hesitancy. I just think is that, hey, you just haven't explained to them correctly why they should get it, right? Like, and the studies already show that the African American community isn't even the community that you should be worried about, right? When it comes to, not getting the vaccine. We know it is the anti-vaxxers. We know it is the anti-maskers. We know it's those people who, like, even after 530,000 people have died from a virus, still don't believe, right? Like, it's real. Like, there's people to this day who will tell you that the coronavirus is some made up disease, right? That the physicians and the pharmaceutical companies made up so they can get some money, right? Like, again, nothing we can do for those people there. But like, those folks are going to be more likely not to get the vaccine than the African American community, even though it almost feels like people are making it seem like the African American community are the ones getting it, right? So like, that's, not going to be exciting. I'll definitely answer that question. We had a question on Instagram. We're going to answer the question. So once you see May 1st come around, and you're going to see an influx of people get said vaccine, it's going to be like I said, the what's going to happen afterwards, right? Because I think people are going to be like so happy, so ready. You're going to see this influx of people like ready to go out and attack the town. Businesses already can't wait for that anyways. If you follow the stock market, you see the stock markets on that same vibe as well too. They're like, hey, let's get these vaccines out so people can travel again, so people can live life again, right? So we can kind of get back to quote unquote normal. So definitely something to think about. Like I said, I'm excited. Like I said, I am definitely a proponent of opening it up across the country. So our general population who's ready to get the vaccine can get the vaccine. So definitely shout out to that. So a question I got on Instagram, sir, does this vaccine cause the disease? Because in my country, when people got polio vaccine, many people got polio. I want to take the vaccine, but I just want to be sure. Very, very, very good question, right? So the question is, does the vaccine, again, we have Moderna, Pfizer, Johnson & Johnson, cause coronavirus? The answer is no. Right. And the reason why the answer is no is because the type of vaccines they are, right. And I made this analogy in reference to like football, right? But you can think of any sport, right? The vaccines only recreate a small portion, right, of the virus, right? A small portion doesn't create the active portion. It creates the small portion that your body will recognize. And the reason why that's important, because if you do happen to get the coronavirus afterwards, your body says, hey, I'm familiar with this small piece of protein here. Let me attack it, right? And once your body attacks it, then guess what? The rest of the coronavirus does not suffice. It doesn't live. It doesn't do what it needs to do. Again, that's why the numbers are so great, especially when it comes to taking, avoiding severe illness, severe disease, hospitalizations, right? The numbers are so great because once your body can recognize like, hey, I know this player here, let me attack it and get it out of here. Like it knows what to do. What the concern that people have, right? And I want people to think about, especially when we think about the coronavirus and then the coronavirus vaccines, none of these vaccines are like a dead version, right, of the coronavirus that says like, hey, here's the dead version of the coronavirus, and let me inject it into you so your body can recognize it. None of these vaccines are that. All of these vaccines are essentially like the playbook for the coronavirus, right? So they'll give your body the playbook to say, hey, when you see something that looks like this, attack it, right? And you rather your body, right, create those antibodies and remember the whole playbook versus you getting sick, right? Because that's a question I typically get following up. Well, if I get the disease, like, isn't that enough? And that answer is no, because if you get the disease, the antibodies that your body creates are are short-lived, versus if I give you the entire playbook of the disease, right, you'll be able to get rid of it. And regardless of when it comes, whether it comes 6 months, a year, like you'll be able to fight it off much more diligently. So that is why, you're not going to have to be concerned about getting coronavirus because of these vaccines, right? Because none of these vaccines are like a dead version of the coronavirus that something may wake up, right, when given to you. Do not have to worry about that whatsoever. But very good question. Like I said, a very common question that I typically get regarding said vaccine. Let's see. Oh, and last but not least, again, that's, as I said, a lot of vaccine talk. JAMA, right? I talked about this. I think I feel like I'm almost sure I talked about it here. But I know I talked about it on my academic hospitalist series on Instagram, right? So the editor for JAMA, right? Again, there was a podcast episode that dropped like a couple months ago, right, or a month or so, that talked about racism, right? And again, that wasn't the issue. Wasn't that it talked about racism? The issue was it talked about the fact that there was no racism, right? That it almost scoffed at the idea, right, that racism was still around. And essentially that, and they even had a tweet that was like, physicians can't be racist, or some crazy, summary of the podcast episode. And of course, right, when it really got out, there was a lot of backfire, right? Because again, I've talked about this before. There's not a field in this country, whether it's the law, right, whether it's healthcare, whether it's business, whether it's government, there's not a field in this country that is not affected by racism, that's not infiltrated by racism. So to think that medicine would somehow be able to avoid, right, the racism virus, right? Again, we're talking about viruses, right? To think that medicine would be able to avoid that, just preposterous, right? And unfortunately, the editor had to step down, right? He had to step down, give his position up, right? Because like essentially they're like, hey man, this does not jive with our ideals, right? This does not jive, with what, especially JAMA, right? The organization, right? This doesn't correlate with what we think when we're talking about racism, structural racism, and the need to combat it, right? Like we can't have a person who's essentially in charge of, being this editor, especially of this amazing magazine. We can't have that person, the editor, who thinks that racism is gone, right? Who thinks that because of laws that were passed in the 60s, we don't got to worry about racism anymore. We can't have that. And they asked for his resignation, and he gave his resignation. Now the question, like, I'm cool with the public gesture, right? Because that's more of a PR thing, right? So the question becomes, what is JAMA? What is the AMA? What are they gonna do now, right? Because now they're gonna have to show, right? Like, because now we're gonna be much more side eyeing them anytime they do something in regards to race, right? So I'm hoping that they get the right people behind them. I see this all the time, right? Where studies occur that I'm like, oh, you could have just asked me. I would have told you what that answer was. Like, studies will occur where like, oh, do African Americans experience more discrimination when it comes to healthcare, right? Like people would like spend money on studies like that when we could have been like, yeah, we do, right? And then that could have been the answer of it. So I just want to see what the actions are going to be from AMA, from JAMA, kind of moving forward. I want to see who they employ, right, into their circle, right, to try to really right the PR ship that has really kind of veered off, right, with this, right? Because like I said, this was like a 15-minute podcast. And again, and it's interesting because there was 2 docs on there. One of them was saying like, yeah, these are some of the effects of structure. Like he was talking like, hey, these are some of the issues with structural racism. And the editor was like, nah, I don't believe it. I don't like. He just like, it was just like such a layer of disbelief that unfortunately he had to go, right? So it is what it is, right? So again, we wish him the best of luck, but we'll definitely be keeping an eye on JAMA to kind of see what they're going to do moving forward, right? It just is what it is. So, that again, that's the end of our discussion this evening. Like I said, I know a lot of it was more slanted on the COVID related stuff, but again, it just is what it is. That's how COVID is. Again, if this is your first time watching it, feel free, remember to always ask questions. Like I said, I love being able to answer questions that you have, right? Especially when it comes to this virus, especially when it comes to this vaccine, right? Because my goal is obviously to get everyone to get vaccinated who can get vaccinated, right? That's a goal of mine, right? But I want you to do it from an educated standpoint, right? So I don't want you to be like, oh, I'm waiting until more people get the vaccine, then I'm gonna get it, right? Okay, that's cool. 100 million people already got it. So what are you waiting for, right? So I want you to do it from an educated standpoint, right? So you feel comfortable getting it, right? Or you feel comfortable saying, yeah, I'm aware of all of the facts, right? But like, I'm still not gonna get it, right? And that's your prerogative. You don't got to get it, right? You just have to deal with the risks associated with not getting it. And if you're cool with that, then you keep it moving. You do what you have to do from that standpoint there. So that's my time this evening. Like I said, you guys be great. Again, I'm gonna catch you next Friday. It's actually it's actually spring break for my kids next Friday. So depending on where I'm at, right, whether I'm like home or maybe I'm out of town, we may have to move it and maybe not do Friday, or maybe we just skip it. Whatever. We can always skip it. So you guys be blessed. Have a great evening. Yours truly, Dr. Barry Pierre.